Imagine being told you're anemic, but hold the iron pills.
Yeah.
It's like, wait, what?
It is counterintuitive, right?
Totally. And that's the situation some people with thalassemia face.
Yeah.
And it's a perfect example of why we're doing this deep dive today.
Uh-huh.
We're unpacking this surprisingly complex blood disorder.
Yeah. It is fascinating how thalassemia can kind of trick us into thinking it's just like a simple iron deficiency.
Right.
But the real issue is a glitch in the production line of hemoglobin, that vital protein that carries oxygen in our red blood cells.
Exactly. And for this deep dive, we're laser focused on you, the listener.
Of course.
So whether you're curious about genetics or maybe prepping for a medical appointment or you're just a knowledge enthusiast,
Yeah.
we'll cover the need-to-know facts, the surprising twists and turns, and really why understanding thalassemia matters in your world.
I think by the end of this, you'll not only grasp the what of thalassemia, but also the why it matters.
Yeah.
We'll connect the dots so you walk away with knowledge you can actually use.
I love it. So let's kick things off with hemoglobin 101.
Okay.
Can you give us a quick refresher on why this protein is so essential?
Well, think of hemoglobin as the body's dedicated oxygen delivery service.
Okay.
It operates inside red blood cells, picks up oxygen from your lungs, and shuttles it to every single cell that needs it.
Okay.
And without enough healthy hemoglobin, it's like your body is slowly suffocating at a cellular level.
That paints a vivid picture.
Yeah.
And that's why I think we feel drained and weak when we're anemic.
Right.
But like we mentioned, thalassemia is a production problem, not
Right.
just low hemoglobin.
Precisely.
Yeah.
To understand this, imagine hemoglobin as like a dynamic duo, like Batman and Robin.
I like it.
You've got the alpha and beta chains, each with its own gene, providing the blueprint for production.
Right.
Thalassemia throws a wrench in the works by introducing mutations into these genes, messing up the whole process.
Okay, so a mutation in either the alpha or the beta gene can disrupt the production of hemoglobin.
Yes.
But I'm guessing it's not that simple, is it?
You're right, it gets a little more complex. We need to consider the types of thalassemia, alpha and beta, each with its own set of genes and a spectrum of severity.
Okay.
Let's start with alpha thalassemia.
Okay, alpha thalassemia. Hit me with the genetic lowdown.
Okay, with alpha thalassemia, we're dealing with 4 genes, 2 from each parent.
Okay.
Think of it like a dimmer switch.
Okay.
The more genes affected by mutations, the dimmer the lights get for hemoglobin production.
So one faulty gene might just cause a flicker, but 4 could mean a blackout.
Exactly. If only one gene is mutated, you might be a silent carrier, completely unaware of the situation. 2 affected genes could result in mild anemia called alpha thalassemia trait.
And what happens when 3 or 4 of these genes are mutated?
Yeah.
Things must get pretty serious then.
Absolutely. With 3 mutated genes, we see hemoglobin H disease, which comes with more severe symptoms like an enlarged spleen.
Wow.
And you can even see bone deformities.
Bone deformities.
Right.
That's not what I expected from a blood disorder. What causes that?
It's fascinating, really. Your body, in a desperate attempt to compensate for the lack of healthy red blood cells, ramps up production in the bone marrow.
Oh, okay.
This overdrive can actually alter bone structure,
Oh, wow.
especially in the face, sometimes leading to maxillary overgrowth, where the upper jaw enlarges.
Maxillary overgrowth. That's definitely going on my list of things to Google later. Now, what about the most severe case with all 4 genes affected?
That's alpha thalassemia major, also known as hydrops fetalis. It's the most severe form, and sadly, it's often fatal before or shortly after birth.
That's heartbreaking. But you mentioned earlier that even these severe cases are important for us to understand. Why is that?
Because it highlights the crucial role of genetic testing and understanding family history.
Oh.
Knowing your carrier status, especially when planning a family, can empower you to make informed decisions and potentially prevent these severe cases in future generations.
That's a powerful point. Okay, we've explored alpha thalassemia with its 4 genes and varying degrees of severity. Now, what about beta thalassemia?
Right.
Does it follow a similar pattern?
Beta thalassemia involves mutations in 2 genes, 1 from each parent. While the range of severity isn't as wide as alpha thalassemia, it still packs a punch.
So walk me through the different scenarios with beta thalassemia. What happens when one gene is mutated versus both?
Okay. Similar to alpha thalassemia, one mutated gene often leads to a mild condition called beta thalassemia minor.
Mm-hmm.
You might be asymptomatic or have mild anemia that doesn't require any specific treatment.
And if both genes are mutated?
That's where we see more significant impacts.
Okay.
If both genes are mutated, but there's still some beta globin production happening, it's
Yeah.
called beta thalassemia intermedia.
Okay.
This results in moderate symptoms, and some individuals might require occasional blood transfusions.
But if both genes are severely mutated and beta globin production is basically non-existent, what happens then?
That's when we encounter beta thalassemia major, also known as Cooley's anemia.
Okay.
It's a serious condition that necessitates regular blood transfusions throughout life to maintain healthy oxygen levels.
Okay, so we've got these two main types, alpha and beta thalassemia,
Yeah.
each with its own set of genes and a spectrum of severity.
Hmm.
But beyond just having low hemoglobin levels,
Right.
what other symptoms can people with thalassemia experience? Is it just like I'm tired all the time?
Fatigues is definitely a common one, which makes sense given the reduced oxygen carrying capacity.
Yeah.
But thalassemia can also present with some surprising symptoms that you might not immediately associate with a blood disorder.
Okay, this is where I always get curious.
Okay.
Tell me more about these unexpected symptoms.
Yeah.
What else can thalassemia do?
For example, splenomegaly or a large spleen is quite common,
Okay.
especially in beta thalassemia major.
Mhm.
It's like your body's overzealous cleanup crew is working overtime to compensate for the faulty red blood cells, but this overactivity can actually lead to more problems down the line.
So the body trying to fix things can backfire and cause even more issues.
Yeah.
That's interesting. What other surprising symptoms can thalassemia cause?
Well, this might surprise you, but thalassemia can affect bone structure, especially in the face. Remember those alpha genes we talked about?
Yeah.
If they're not functioning correctly,
Yeah.
it can lead to maxillary overgrowth where the upper jaw enlarges. It's one of the ways the body tries to compensate for the decreased oxygen carrying capacity.
Wow. So we've got fatigue, an enlarged spleen, and even facial bone changes.
Yeah.
Are there any other symptoms we should be aware of?
Yes. There are a few more. Dark urine can be a sign of thalassemia indicating hemolysis, which is the breakdown of red blood cells.
Okay.
And in children, thalassemia can sometimes impact growth
Okay.
due to the chronic anemia.
It really does affect the whole body, doesn't it?
Right.
So let's say someone has some of these symptoms
Yeah.
and the doctor suspects thalassemia.
Right.
How do they go about diagnosing it? Is it just a simple blood test?
A complete blood count, or CBC, is definitely the starting point.
Okay.
It can reveal those telltale signs of anemia.
Hmm.
But what's really key is looking beyond the numbers and examining the details of the blood work.
Okay. What kind of details should we be paying attention to? What are the clues hidden within the blood work?
One important detail is something called microcytic hypochromic anemia. Imagine these red blood cells. They're like tiny, pale ghosts struggling to carry enough oxygen. That's a telltale sign that something's amiss with hemoglobin production.
So it's not just about the quantity of red blood cells, but their quality and appearance.
Exactly.
What other tools do doctors use for diagnosis?
A peripheral blood smear, which allows us to see the actual shape of red blood cells under a microscope,
Oh, cool.
can also provide valuable clues.
Oh.
For instance, we might spot target cells,
Target cells.
which look like little bullseyes, another sign pointing towards thalassemia.
It's amazing how much information can be gleaned from just a few drops of blood. What other tests are used for diagnosing thalassemia?
Another important test is hemoglobin electrophoresis.
Okay.
It separates the different types of hemoglobin present in the blood, almost like creating a fingerprint for the disease. This helps distinguish between different types of thalassemia and other hemoglobin disorders.
Fascinating. So we've got the CBC, the blood smear, and hemoglobin electrophoresis. What about genetic testing? Does that play a role in diagnosis as well?
Absolutely. Genetic testing can confirm the diagnosis by pinpointing the exact mutations in the globin genes.
Wow.
It's also essential for family planning as it can determine carrier status, which helps couples understand their risk of having a child with thalassemia.
So diagnosis involves a combination of blood tests, examining the red blood cells under a microscope, and even looking at the genes themselves.
Mm-hmm.
Now, once thalassemia is diagnosed, how is it managed? Is there a standard treatment plan that works for everyone?
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.
We've covered a lot of ground so far, from the genetics of thalassemia to the diagnostic tests used to identify it. Now let's shift gears and talk about management. Is there a one-size-fits-all approach to treating thalassemia, or does it vary depending on the type and severity?
Managing thalassemia is definitely not a one-size-fits-all situation. The approach varies greatly depending on the type and severity of the condition. This is where that whole iron confusion comes into play, remember?
Right. We talked earlier about how not everyone with thalassemia needs iron supplements. In fact, for some, extra iron can be harmful. Why is that?
Well, in milder forms of thalassemia, like thalassemia minor, the body might still be producing enough hemoglobin to function relatively well. In these cases, treatment might not be necessary at all, but regular monitoring is essential to catch any potential issues early on.
So even if your thalassemia is mild, it's still important to keep an eye on things. What about the more severe forms, like beta thalassemia major? How are those managed?
For severe cases, regular blood transfusions are the lifeline. They provide a steady supply of healthy red blood cells, ensuring the body gets the oxygen it needs. However, this frequent influx of blood introduces a new challenge: iron overload.
That's right, we touched on that earlier. Can you explain why iron overload is a concern for people receiving regular blood transfusions?
Each blood transfusion delivers iron along with the red blood cells.
Yeah.
Over time, this can lead to a buildup of iron in the body, which can damage vital organs like the heart, liver, and pancreas. It's a serious complication that needs to be carefully managed.
So it's like a balancing act. You need the transfusions to deliver oxygen, but you also have to deal with the excess iron. How do doctors manage iron overload in these cases?
That's where chelation therapy comes in. It involves medications that act like tiny magnets binding to the excess iron and helping the body eliminate it. There are different types of chelation therapy, each with its own set of pros and cons, so finding the right one for each patient is important.
So managing severe thalassemia involves this constant juggling act of ensuring enough oxygen through transfusions while also keeping iron levels in check with chelation therapy. It sounds pretty complex.
It can be.
Yep.
It requires a dedicated healthcare team, regular monitoring, and an individualized treatment plan tailored to each patient's specific needs.
We've been focusing a lot on the medical aspects of thalassemia, but I imagine living with this condition has implications that go beyond just blood tests and treatments. What are some of the broader challenges people with thalassemia might face?
You're absolutely right. Thalassemia can impact various aspects of a person's life, from their physical health to their emotional well-being and social interactions. It's crucial to address these challenges with a holistic approach, considering the whole person, not just their blood counts.
Okay, I'm really interested in this. Let's dive into some of these broader topics. For instance, how does thalassemia affect pregnancy? What unique challenges do expectant mothers with thalassemia face?
Pregnancy with thalassemia can be a bit more complex, both for the mother and the developing baby. For women with milder forms of thalassemia, like thalassemia minor pregnancy, might proceed relatively smoothly with careful monitoring. However, they might experience increased fatigue and require additional iron supplementation.
And what about women with more severe forms like thalassemia major?
But for them, pregnancy can be even more challenging. They might require more frequent blood transfusions to maintain adequate hemoglobin levels for both themselves and the growing fetus. The management of iron overload also becomes even more crucial during pregnancy.
And what about the baby? Is there a risk that the baby will inherit thalassemia if one or both parents have the condition?
Yes, there's a significant risk of passing on the thalassemia gene. If both parents are carriers of a thalassemia gene, there's a 25% chance with each pregnancy that the baby will inherit the disease. Genetic counseling is crucial for couples planning a family to understand the risks, explore testing options, and make informed decisions.
So pregnancy with thalassemia definitely requires a lot of planning, careful monitoring, and open communication with healthcare providers. Now, what about the psychological and emotional impact of living with a chronic condition like this? It must take a toll on mental health.
You're absolutely right. It's not easy dealing with regular blood transfusions, managing iron overload, and facing the uncertainty of potential complications. It's not uncommon for individuals with thalassemia to experience anxiety, depression, and feelings of isolation.
That makes sense. It's a lot to cope with, both physically and emotionally. What can be done to support the mental health of people with thalassemia?
That's where a supportive network of healthcare providers, family, and friends comes in. Access to mental health professionals who understand the unique challenges of living with a chronic illness can be invaluable. Support groups can also provide a safe space for individuals to connect with others who share similar experiences, reducing feelings of isolation and fostering a sense of community.
It's amazing how much strength and resilience can be found in connecting with others who truly understand what you're going through. Now, switching gears a bit, what about social stigma? Do people with thalassemia ever face discrimination or misunderstanding from others?
Unfortunately, yes. In some cultures, there's a stigma associated with blood disorders, which can lead to discrimination, misconceptions, and a lack of understanding from others. This can make it even harder for individuals with thalassemia to cope with the challenges they face.
That's so disheartening. It's a reminder that we need to educate ourselves and challenge those harmful stereotypes.
Now, for our listeners who are looking for reliable information and support for thalassemia, where should they start? What resources would you recommend?
There are some fantastic organizations dedicated to supporting the thalassemia community. I always recommend checking out the Thalassemia International Federation and the Cooley's Anemia Foundation. They provide a wealth of information, connect patients with support groups, advocate for research and improve care, and really empower individuals to take control of their health.
Those sound like great starting points. What about online communities? Are there any online forums or platforms where people with thalassemia can connect and share their experiences? Absolutely. Social media platforms like Facebook and Instagram have numerous groups and pages dedicated to thalassemia. They can be a fantastic way to connect with others, find emotional support, exchange practical tips, and learn from shared experiences.
It's amazing how technology can bring people together, creating a sense of community, even across geographical boundaries. Are there any other online resources you would recommend for staying up to date on the latest advancements in thalassemia research and treatment?
Yes, many reputable websites and online publications provide updates on new research breakthroughs, treatment options, and clinical trials. Staying informed can empower individuals to make informed decisions about their care and participate in cutting-edge research.
Knowledge is power, especially when it comes to managing a complex condition like thalassemia. We've covered a lot of ground in this. We've gone from the microscopic world of genes and blood cells to the broader challenges and triumphs of living with thalassemia.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.
We've been exploring the intricate world of thalassemia, and in this final part, we're shifting our focus to you, our listeners. We've received some fantastic questions, and we're here to share our insights and expertise.
Yeah, we got some really thoughtful questions that touch on various aspects of thalassemia,
Right.
from managing milder forms to the complexities of bone marrow transplantation. We're excited to delve into these topics and provide some clarity.
Before we jump in, a quick reminder, always consult with your healthcare team for personalized guidance.
Absolutely. Individualized care is crucial when it comes to managing thalassemia.
Okay, let's dive into our first question. This one comes from Sarah, who writes, I've been diagnosed with thalassemia minor. My doctor says I don't need any treatment, but I'm still feeling a bit anxious. What are some long-term risks I should be aware of?
It's understandable to feel concerned, Sarah, even if your doctor has assured you that your condition is mild. While thalassemia minor often doesn't require active treatment, it's still important to be mindful of potential long-term implications. It's like having a slightly leaky faucet.
Okay.
You might not need to call a plumber just yet, but it's worth keeping an eye on it to prevent bigger problems down the line.
That's a great analogy. So what kind of leaks should people with thalassemia minor be watching out for?
Well, even though it's considered mild, thalassemia minor can still impact your energy levels. Fatigue is a common symptom, so listening to your body, getting enough rest, and maintaining a healthy lifestyle are crucial. Think of it as providing your body with the extra support it needs to function optimally, even with that slightly leaky faucet.
Those are all great everyday habits we should all be practicing anyway. Are there any specific situations where thalassemia minor might become more of a concern?
Pregnancy is one such situation. The increased demand for red blood cells during pregnancy can exacerbate anemia even in women with thalassemia minor. It's essential to work closely with your doctor to monitor your blood count and ensure you're getting the necessary support.
So even if you've been managing thalassemia minor without any issues, pregnancy is a time to be extra vigilant. What other long-term risks should people with this condition be aware of?
Iron overload, although less common in thalassemia minor than in more severe forms, is still something to consider. It's a good idea to have your iron levels checked periodically, especially if you have a family history of iron overload or if you've received blood transfusions in the past.
Makes sense. It's always better to be safe than sorry. Our next question comes from David, who asks, My child has been diagnosed with thalassemia intermedia. We're trying to decide if a bone marrow transplant is the right option for him. What factors should we consider?
That's a weighty decision, David, and one that deserves careful consideration and consultation with your child's medical team. While bone marrow transplantation offers the potential for a cure, it's not a decision to be taken lightly. It involves a complex procedure and potential risks that need to be carefully weighed against the potential benefits.
What are some of the risks associated with bone marrow transplantation?
The procedure itself is quite complex, and like any major surgery, it carries risks of complications such as infection or rejection of the transplanted cells. The preparation for the transplant also involves intense chemotherapy or radiation therapy, which can have significant side effects. It's a tough journey, but for some families, the potential for a cure outweighs the risks.
It sounds like a very personal and difficult decision. Are
Right.
there any factors that might make bone marrow transplantation more or less suitable for a particular individual?
Absolutely. One crucial factor is finding a suitable donor. Ideally, the donor would be a sibling with a perfect tissue match, but this isn't always possible. And even with a matched donor, there's no guarantee that the transplant will be successful. The child's overall health age and the severity of their thalassemia also play a role in determining the potential success and risks of the procedure.
So it's a multifaceted decision with no easy answers.
Yeah.
What advice would you give to families grappling with this choice?
My advice would be to gather as much information as possible from trusted sources, engage in open and honest conversations with your child's medical team, and don't hesitate to seek a second opinion. It's crucial to weigh the potential benefits of a cure against the risks and consider your child's unique circumstances and individual needs. There's no one-size-fits-all answer, and ultimately the decision rests with the family in consultation with their healthcare providers.
That's such an important point. Every case is unique, and what's right for one person might not be right for another. Our final question comes from Maria, who writes, I'm feeling overwhelmed by all the information about thalassemia. What's the most important piece of advice you would give to someone newly diagnosed with this condition?
That feeling of overwhelm is completely understandable. Maria thalassemia is complex, and there's a lot to absorb both medically and emotionally. If I could offer one piece of advice, it would be this: build a strong support network.
That's great advice. But what does building a support network look like in the context of managing thalassemia?
It means finding a healthcare team you trust and feel comfortable communicating with. Having a doctor, nurse, or genetic counselor who understands your condition and can guide you through the treatment process can make all the difference. It also means connecting with other individuals and families affected by thalassemia, either through local support groups or online communities. Sharing experiences, exchanging information, and knowing you're not alone in this journey can provide immense emotional support.
That's a powerful reminder that we're not meant to navigate these challenges alone. Community and connection can be incredibly healing and empowering. Well, I think we've covered a lot of ground in this three-part deep dive into the world of thalassemia. We've explored the science, the complexities of management, and the emotional and social aspects of living with this condition.
Yeah, it's been quite a journey.
It has. We've learned that thalassemia is not just one disease, but a spectrum of conditions, each with its own unique set of challenges and opportunities.
And it's amazing to see how much research is being done
It
to
is.
find new treatments and even cures.
And most importantly, we've highlighted the incredible resilience, strength, and hope that exists within the thalassemia community. To all our listeners, thank you for joining us on this journey of discovery. We hope you found this deep dive informative, empowering, and perhaps even a little bit inspiring.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.